Hello everyone, we are undergraduate student, pharmacy student from Airlangga University, Indonesia. In this occasion, we will briefly but deeply explaining the two things that are widely known in the global technology, knowledge, and the medical products, which are Internet of Things and pharmacy, which led us to our presentation titled the Utilization of IoT in Pharmaceutical Needs. Here are the team that help us structure this material for our presentation tonight. Okay, for introduction, the Internet of Things, or IoT, represents a technological revolution in which everyday objects and industrial system connects via the internet to exchange data, perform analysis, and control autonomous actions. In the pharmaceutical industry, the Internet of Things, or IoT, opens unique opportunities while addressing specific challenges related to strict regulation and high standards for product quality and safety. In today's discussion, we will focus more on two of the most popularized IoT adaptation in pharmaceutical worlds. The first one is smart pill dispenser, and the second one is remote patient monitoring for chronic illness. Now we'll start from the first one, which is smart pill dispenser. They are specialized IoT devices designed to address medication non-adherences, a significant healthcare challenge, combining hardware and software components to automatically dispense medication at prescribed times and track consumption patterns. Now, the smart pill dispenser contains typically incorporates six things. The first one is microcontroller based system for precise timing and control. The second one is real-time clock or RTC modules for medication scheduling. The third one is notification system such as buzzers, LEDs, or mobile alerts. The fourth one will be dispensing mechanism using motors and compartmentalized containers. The fifth one is authentication mechanism, and the sixth one is connectivity features for real-time monitoring and data transmission. You can see one of the examples as the picture in this area. Okay, so the next.
Okay, now we've know about what smart pill dispenser is. So we're gonna talk about application of this device. The use of this device is very wide, not only in this hospital, but also in manufacturing, even in-house use. So let's talk about this deeper. So the first application of smart pill dispenser is in hospital and clinical settings. In hospital, smart pill dispenser make the medication distribution more effective and efficient. Medical personnel can also access valuable data regarding which patient receive a specific medication and when. And by automating this process, healthcare professional can dedicate more time to patient, requiring intensive care rather than preparing medication and conducting medication rounds. And the second is in community and home use. In community settings, smart pill dispensers provide critical support for elderly care that elderly people often struggle to remember their medication schedule. Smart dispenser enable independence while ensuring proper medication adherence. And the second, in household, the increasing popularity of vitamins and nutritional supplements has created demand for personalized dispenser that can provide tips reminders according to dietary schedules. And the third is mental health management. IoT-enabled dispenser offer particular benefits for patients with mental and cognitive health conditions who may struggle with medication management. And then in pharmaceutical manufacturing and supply chain, in pharmaceutical manufacturing and logistics, IoT technologies enable to precise monitoring and control of manufacturing process to increase efficiency while ensuring compliance with strict quality standards, like end-to-end supply chain transparency through RFID tags, GPS, and other sensors that track pharmaceutical products. Comprehensive documentation to meet increasing regulatory requirements from various countries and legislative bodies.
Okay, then I wanna tell about the benefit, limitations, and ethical issues of smart pill dispenser. And number one is improve adherence, or we can call enhanced medication adherence. Research indicated notable improvement in adherence, with one study reporting a substantial 67% decrease in missed or delayed doses. And number two, lower healthcare costs or cost reduction. Personalized medication management have been linked to significant long-term saving in the medication expenses. Number three, remote learning opportunities. IoT enabled platform provide educational research such as instructional videos, live webinars, and interactive content to help patients better follow their treatment plans. And next, okay, limitation of smart pill dispenser is number one, accessibility barriers. Okay, in here, accessibility barrier is high cost and complex interface limit accessibility, particularly for economically disadvantaged population. And number two, technical complexity. Some existing systems require difficult setup, process, or manual time setting procedures that might be challenging for certain users. And then technology dependence. Reliance on batteries, internet connectivity, and functioning sensor create potential point of failure. And next, number three, or last, ethical issues of smart pill dispenser. And number one is privacy concerns. The collection, transmission, and storage of sensitive health data raise questions about privacy protection and data ownership. And number two, patient autonomy. Over monitoring could, could potentially undermine patient autonomy and sense of control over their own healthcare. And then data access question. Ethical question arise regarding who should have access to adherence data healthcare providers, family members, or insurance companies.
Okay, so the next one, the second application in IoT in pharmaceutical world will be the remote patient monitoring or for chronic illness or RPMCI. Now, this remote patient monitoring represent a significant advancement in healthcare delivery and particularly for chronic disease management. By leveraging technology to connect pharmacists, patients, and healthcare providers, this system offers promising solution to long-standing challenges in medication adherence and disease control. So the remote patient monitoring refers to the use of digital technologies to collect the health data from patients in one location and electronically transmit that information to healthcare providers for assessment and recommendation. In the pharmacy context, RPM combines medical monitoring solution with the hands-on expertise of community pharmacies to improve patient care, particularly for those with chronic condition.
Okay, now the application and case study of RPMCI. So RPM is applied through the use of wearable devices and sensors connected to the Internet or cloud. Example of application include monitoring blood pressure, blood sugar level, heart rate, oxygen saturation, and daily physical activity of patients. The collected data is automatically sent to a back-end system where it is analyzed and used to support clinical decision-making by doctors. RPM also allows doctors to provide recommendation or intervention quickly if a medical condition is found to be of concern to the patient. And now here we have chronic disease monitoring system for the example. So chronic disease monitoring system designed to overcome some of the limitations of existing RPM architectures. The system leverage multiple components such as the Internet of Things, wireless body area network or WBAN, cloud computing, and clinical decision support system or CDSS. Wearable sensors collect patient vital data, which are then sent to the cloud for analysis. The AI-based CDSS assists physicians in diagnosis and providing therapeutic recommendation based on the data received. This case study demonstrates that RPM is effective in improving the quality of healthcare, accelerating diagnosis, and reducing overall healthcare costs.
Okay, next, I want to tell again about the benefit, limitations, and ethical issues of mobile health in remote patient monitoring for chronic illness, or RPMCI or RMPCI is same, no problem. For first, I want to tell benefit of RMPCI. Number one is improvement in care quality. RPM or remote patient monitoring enables real-time monitoring of patients' vital signs, allowing doctors timely and accurate decisions. This enhances the speed of diagnosis and improves patient care quality. Number two is cost efficiency, of course. The use of RPM can reduce the need for hospital visits, lower hospitalization costs, and overall save on the healthcare expenses. Number three is enhance patients' independence and awareness. RPM empowers patients to be more aware of their health condition and live more independently, as they can be continuously monitored without frequent visits to healthcare facilities. And next, and then is limitation of RMBCI. Number one is data quality and accuracy. The success of RPM heavily depends on the quality of the clinical data collected. Inaccurate or incomplete data can lead to incorrect decisions and reduce doctors' trust in the system. And number two is reliance on technology infrastructure. RPM depends on robust technological infrastructure such as internet connectivity, wearable device, and cloud-based system. Technological constraints in certain areas may present a major implementation challenge. And number three is data security and privacy concern. RPM implementation faces significant challenge, particularly in safeguarding against data breach and preventing unauthorized access to sensitive patient health records. And next, and last is ethical issues of RMPCI. Number one is data privacy and confidentiality. Digital health data collection and transmission create privacy risk. Robust data protection, encryption, and adherence to regulation are essential to preserve patient confidence. Number two is informed consent process. Prior to enroll in RPM, patients should receive comprehensive disclosure about its advantage, potential risk, and technical limitation. Obtaining valid informed consent carries heightened significance in digital healthcare settings. And last, equitable access challenge. RPM implementation risk excluding patients without adequate technology or internet access, exacerbating existing disparities in healthcare delivery.
Okay, so the conclusion of this presentation is Smart Pills Dispenser and MPCI powered by IoT technology represent a significant advancement in medication management, offering a substantial benefits for patient care while presenting certain limitations and ethical challenges. As this technology continue to evolve, addressing accessibility, security, and verification concerns will be crucial to their widespread adoption and effectiveness. The potential for improved healthcare outcomes, particularly for vulnerable populations like the elderly and those with chronic condition, make this an important area for continued development and research. Both innovation, smart pill dispenser, and RPMCI leverage IoT technology to improve healthcare quality, particularly in chronic disease management. However, they also face challenges regarding cost, technology access, and ethical issues related to data privacy and equitable access to healthcare services. Okay, that's all. If you have any
Okay, so
questions,
here are
please
the
don't let
references we
us.
are using. Okay, so here are the references we are using for to make this presentation. We are using in total of 7 references. 4 are used for the smart pills. This is the smart pills references, and these are the references we are using for the remote control patient. So, and that signs us the end of this presentation. We're very grateful for all of your attention in this occasion. We're deeply sorry for any language mistake and presentation flaws. Thank you very much for your attention.